Hello everyone, and today's topic is the reproductive system. Introduction: the ability to produce and ones of the properties distinguish living and non-living matter. The more primitive the animals, the simpler the process of reproduction. In mammals, including humans, the process is one of the sexual reproduction in which the male and female organ differ anatomically and physiologically, and the new individual develops from the fusion of two different sex cells, that is gametes. Male gametes are called as a spermatozoa, and the female gametes called as the ova. First, we will see the female reproductive system. External structure of female reproductive system are mons pubis, that is soft mound of flesh above the genitals, and labia means like lip-like a structure on the outside of the vagina. Then the clitoris means a sex organ whose sole function is to play is a pleasure. Next is the internal structure of female reproductive systems are vagina, hymen, cervix, uterus, fallopian tube, and ovaries. First, vagina is a tract from uterus to exterior, and hymen is a mucous membrane around the vaginal opening, and cervix means a lower narrow portion of the uterus. Then the uterus means pear-shaped organs containing growing the fetus, and fallopian tube is a pathway for eggs travel during the ovulations. Ovaries means the egg production organs. Then we will see the what are the functions of female reproductive systems. Formation of ova, reception of spermatozoa, and provision of suitable environments for fertilization and fetal development. And parturition means childbirth. Lactation, the production of breast milk, which provide complete nourishment for the baby in its early life. Then we will see some disorders related to the female reproductive system. Then the pelvic inflammatory diseases are progressive infections, get worse over time, affect and it affect the fallopian tube, uterus, cervix, or ovaries, can lead to long-term reproductive problems. Symptoms like smelling discharge heavier than normal periods, and painful urination. Causes of pelvic inflammations are bacteria move upward from woman's vagina or cervix. Cervix means opening to the uterus into her reproductive organs. Many different organisms can use PID, which may cause causes cases are associated with gonorrhea. To gonorrhea are these are very common bacterial STDs. Next is the toxic shock syndrome. It is a systematic illness and it affects the whole body. Causes of the toxic bacterial infections syndromes are using super reabsorbent tampons, wearing a diaphragm or contraceptive sponges, having a staph or staph infection, especially if you have skin wounds or healing surgical incisions. Symptoms such as high fever, rapid drop of blood pressure, sunburn like rashes, and weakness. Next is endometriosis. In this, the tissue begins to grow on the outside of the uterus. Causes of endometriosis is menstrual blood containing endometrial cells and flow back through the fallopian tubes and into the pelvic cavity instead out of the body. And these display endometrial cells stick to the pelvic walls and surfaces of pelvic organs where they grow. Symptoms such as severe pelvic pain, constipation, diarrhea, pain when having intercourse, and cause infertility. Next is the male reproductive system. In that, the external structure of male reproductive system contains a penis and scrotum. Penis is the external male sex organ, and is circumcised and uncircumcised. Remove some or all of foreskin, and foreskin not removed. Scrotum means sac of skin and muscles containing testicles. These are externals. Next is the internal structure of male reproductive system are prostate, vas difference, epididymis, urethra, corpus gland, seminal vesicle. In this, prostate gland is the endocrine gland of male reproductive system, and vas difference is tube connecting epididymis to ejaculating duct, and epididymis means the organ where sperms are mature. Next, testicles means organ where sperms is created. Urethra, a tube that connect the bladder to outside of the body, and corpus gland secrete the lubricating fluid, and a seminal vesicle makes seminal fluid. What are the sperm pathway or structure and functions? Sperm pathway: first testes, then sperm, then epididymis, then vas difference, then seminal vesicle, then ejaculating duct, and prostate gland, urethra, and expulsion from the body. What are the functions of male reproductive systems? Are produce, maintain, and transport sperm, the male reproductive cells, and protective fluid, that's semen, to discharge sperm within the female reproductive tract during sex. What are the disorders or disease regarding to the male reproductive systems? Are prostate cancer, that cancer of prostate, most common in African America men over the age of 50s. Next is the testicular cancer, most common cancers in male between the age of 15 to 34, highly treatable when diagnosed early. Signs include the collection of fluid in the scrotum and lump or enlargement in either testicles, and an unexplained fatigue. Next is the testicular torsions. Testicular